My name is Dr. Matthew Cooper, and I want to thank everyone here at the Seed, Food, and Wine Festival for having me. I know there's a lot of people here who eat raw foods, right? Raw food advocates. How many people here eat raw food? Okay, great. Somebody, anyone, tell me why you eat raw food. What's the benefit? Go ahead. Good answer. Educated audience makes my life a lot easier. So basically, when you cook food over 118 degrees Fahrenheit, you destroy all of the enzymes that are in the food. And so that's the number one reason why eating raw food is so healthy. Okay, it's the enzyme content. Does anyone here know what an enzyme is? Have you heard the words before? Okay, good. So again, educated, good audience. Enzymes are found in any food that was once alive. So any plants, any vegetables, any fruits, and there do I say here, even meat. Yes, even meat has enzymes in it, okay? And these enzymes are inherent in your food. A potato, which is very high in starch, has tons of amylase in it. And amylase will allow you to digest and absorb your sugars or your carbs. An avocado, which is very high in fat, has a lot of lipase in it. And a lipase allows you to digest and absorb your fat. So our foods, our fruits, our vegetables, our meats, they have inherently in them what's needed to digest and absorb them. And enzymes are the only things that are small enough to break foods down into smaller particles so the food can get through the digestive system and into the cells, into the blood, and then you can absorb and utilize the nutrients from the food. And when we talk about enzymes, they all want to say, oh, just like probiotics, right? The answer is no. Nothing can help you digest your food except for enzymes. Probiotics cannot do that. Fiber cannot do that. Even today, I heard people tell me that they take Pepsin or Zantac or Prilosec, the prescription medication, that will not help them digest their food. The only thing that can help you digest food are enzymes. The problem is that due to numerous food practices, which they're too long to list and talk about in a 30-minute presentation, but the food companies have systemically been removing the enzymes from the food to prolong the shelf life of food, to make more money. And they're making more money, and Americans as a society, we're getting sicker, we're getting fatter, we're getting type 2 diabetes and metabolic syndrome and other things that are really there, I think, because of the quality of our food. We created as an enzyme product called Enzyme Doctor, and it's a very wide-based, plant-based enzyme formula that will help you digest all food groups: carbs, fats, proteins, sugars, fiber, cellulose, lactose for milk. But most people think, and I think most people here agree, eating well, well-balanced food is proper nutrition. And I used to think that. But I'm going to read you the definition from the American Heritage Science Dictionary, which I'm sure you've all read before. It says here that the definition of nutrition is the process by which humans obtain food and use it for growth, metabolism, and repair. The stages of nutrition include ingestion, digestion, absorption, transportation, assimilation, and excretion. There's 6 parts to proper nutrition. Eating or ingesting your food is only one of them. It could be a big part of proper nutrition, but there's 5 other components to it, right? And the only other thing that can take care of those 5 other components are enzymes, nothing else. If you eat something and you get a negative response, it's a digestive issue. I can eat pasta and be perfectly fine. You may eat pasta and get type 2 diabetes and gain weight. You may drink milk and be perfectly fine. I drink milk and get diarrhea and I get acne, okay? You may eat meat and get gout. I can eat meat and be perfectly fine. We all falsely assume that if we all eat the same foods, we're gonna digest and absorb and utilize and eliminate the foods the same, but it's just not the case. So again, I wanna talk a little bit about Enzyme Doctor. I've been using these in my practice for 12 or 13 years. The formula that we made was made by people who've been using plant-based enzymes for 30 years. They pretty much started enzyme therapy and digestive enzymes. I've been using it for 12 years. We've changed this formula 5 times to get it perfect to where it is right now. And for anyone who's healthy and wants to digest and absorb their food better, or people who have any of these symptoms of heartburn, indigestion, reflux, irritable bowel, gas, bloating, chronic diarrhea, this product will help you pretty instantly. It's not a cure, okay? This will help you digest your food better. If you stop taking the enzymes, you're going to have your problem again. So the question was, is this good for children? What I could tell you is that there are enzyme children here who take enzymes to help them digest and absorb their food and help to have them normal bowel movements. I have 2 kids. My daughter is 8 and my son is 6. And since they were 6 months of age, they've been taking enzymes. My true feeling is that if we eat the food that we're given in this country, you have no choice but to take digestive enzymes with your food.